Hello and welcome back. Today I'm bringing this program to all my viewers who have been told by their partners that they snore loudly at night and their partner have to sleep in a different room. You could be suffering with a condition called sleep apnea. Sleep apnea explains itself. Apnea means a stop to breathe and sleep means sleep. So if you are having interruption in sleep and you're stopping to breathe, you could be at a risk for sleep apnea. Sleep apnea has many characteristics and I'm going to name a few. If you are experiencing loud snoring at night, if you are gasping for air at night, if you're waking up in the middle of the night and unable to go back to sleep, if you are waking up in the morning with a headache, if you're waking up with extreme fatigue and tired and lethargy and difficulty to stay awake during the day, if you are feeling like you need to take some naps during the day, if it is difficult for you to pay focus and attention at work, if you are gaining weight, if you are feeling like that your brain is foggy and fuzzy, if you are having all of these symptoms or some of these symptoms, then you could be suffering with a condition called sleep apnea. I'm going to tell you who is at a risk for sleep apnea because it's a very important question. Anybody who gains weight, who gains 5 to 10 pounds of weight, excessive weight, patients who are obese and overweight, they're all at a risk for sleep apnea. Being a male itself is a high risk for sleep apnea. Overweight male and obese male, obviously that doubles the risk for sleep apnea. If females also gain weight and they become overweight and obese, they also increase the risk for sleep apnea. If you have narrow passages in your upper airways, which has to be told to you by your doctor, of course, then you are at a risk for sleep apnea. If you have a family history of sleep apnea, that increases your risk as well. If you have a thick neck and abdominal obesity, if you have increased abdominal girth, that also increases your risk for sleep apnea. People who consume alcohol and sleep medications are increased risk for sleep apnea. Smokers also increase the risk for sleep apnea. So there are many conditions as well, like a sinusitis, allergies, asthma, and recurrent infections can also increase your risk for sleep apnea. Now, once you are diagnosed with sleep apnea, what are the complications of sleep apnea and what can it do to you? Sleep apnea can cause sudden cardiac death. It's a very serious condition and it's a very dangerous condition. It should be diagnosed early and it should be treated early, and it can be prevented as well. Sudden cardiac death can be prevented by correcting the sleep apnea. It can cause high blood pressure and can lead to hypertension. It can cause high cholesterol levels and can cause heart disease. It can cause increased blood sugar levels and can cause diabetes mellitus. It can increase your risk for having accidents if you are driving and being very sleepy and fatigued during the day. It can also cause sleep-deprived partners, which is of course a problem. It can cause mood disorders, depression, fatigue, and irritability. Now, if you think that you have sleep apnea, what is your next step? You should go to your doctor and you should get a sleep study done. Sleep study can be done at home, which is a screening sleep study, and if that is abnormal, your doctor can also suggest in-lab sleep study, which is more accurate. If you are diagnosed with sleep apnea, depending upon what stage of sleep apnea you are at or how is the severity of the sleep apnea, you can be treated accordingly. Patients with mild to moderate sleep apnea, weight loss is essential in any type of the sleep apnea, as well as the oral devices are available for mild to moderate type of sleep apnea treatment. However, people who have moderate to severe sleep apnea may need to use the CPAP machine, which is readily available, and a lot of modified forms are available to make it easy for you to use. Some people also require surgery. It is up to your doctor who recommends you what kind of treatment you need for the sleep apnea. So if you have any of those symptoms that I just explained, please go and check with your doctor, get a sleep study done, and get it self-treated. Thank you so much for listening and see you next week.